There are a number of different treatments available for malignant mesothelioma, a form of cancer that affects the mesothelium, which is a lining that covers many of the body's internal organs. Treatment options fall into three main categories: established therapies, experimental treatments, and holistic therapies. Established or conventional therapies include chemotherapy, radiation therapy, and surgery. One of the first steps in determining the most appropriate treatment option is staging the disease. This process involves ranking the severity of the disease based on issues such as whether the cancer has spread from one side of the chest to the other, whether it has spread to lymph nodes, and whether it has metastasized to other parts of the body. In making treatment recommendations, physicians will assess factors such as the stage of the disease, a patient's age, general health, gender, and a patient's wishes. Patients are also strongly encouraged to learn as much as possible about the disease's progression and available treatment options, and to play an active role in decision-making about their treatment. Radiation attacks cancerous cells to keep them from dividing rapidly. It can also be used to reduce symptoms. However, radiation can also kill healthy cells, and so must be directed as accurately as possible at the cancer cells. It is important to note that mesothelioma is commonly resistant to this form of therapy. Radiation is often used with chemotherapy drugs and/or surgery. Radiation therapy can be administered either internally or externally. Internal radiation is delivered into the body and can be either unsealed or sealed. Unsealed internal radiation is delivered by an injection or by a pill. Sealed internal radiation is implanted into the body using a wire, seed, or capsule. External radiation is generated by a linear accelerator or by a type of machine that uses a radiation source. External radiation is administered as an outpatient procedure 5 days a week for several weeks. By contrast, internal radiation therapy involves a 3-day to 1-week stay in the hospital. Side effects of radiation include shortness of breath, exhaustion, nausea, and reactions such as hair loss in the treated areas. Chemotherapy is a type of treatment that uses drugs to attack cancer cells. There are several categories of chemotherapy. Neoadjuvant therapy shrinks a tumor before surgery is performed, with the goal of making the surgery less invasive or involved. Adjuvant therapy kills cancer cells that remain after surgery. Chemotherapy drugs can also be used to increase the effects of either radiation or immunotherapy. It can also be used to destroy cancer that comes back or that has metastasized or spread to other parts of the body. Chemotherapy drugs work differently, but they all focus on getting rid of cancer cells and keeping them from spreading further. Two of the most frequently used chemotherapy drugs are gemcitabine and cisplatin. Drugs may be administered individually or in pairs in a method called combination therapy. Common pairings include raltetrexate and cisplatin, methotrexate and vincristine, cisplatin, vinblastine, and mitomycin, cisplatin and doxorubicin, and doxorubicin, cyclophosphamide or ifosfamide, and cisplatin. Because these drugs are so powerful, they often affect healthy cells in the body as well. Specifically, they affect cells that grow quickly, including hair and cells that are found in the mouth and stomach. This is why hair loss is such a common side effect of chemotherapy. Other side effects include nausea, vomiting, and fatigue. Most side effects end once treatment is over. Chemotherapy drugs can be administered intravenously or orally. Chemotherapy drugs can also be administered directly into the chest cavity or the abdominal cavity, the two most common sites of mesothelioma. The length of a chemotherapy course varies, and patients can receive chemotherapy at the hospital or at a doctor's office. There are two general approaches to surgery to treat mesothelioma. Curative surgery to slow or stop the growth of the disease and to extend a patient's life, and palliative surgery, which helps to reduce the pain related to a tumor or to symptoms, such as fluid buildup in the pleural cavity or abdominal cavity. Curative surgery is performed when doctors believe there's a likelihood of curing the disease by removing an entire tumor that is not spread aggressively. At its most effective, surgery can lead to a remission or a period during which a patient is cancer-free. One example of curative surgery is pneumonectomy, in which a doctor removes a patient's lung. Palliative surgery is intended to relieve symptoms and to increase a patient's comfort. This type of surgery will be performed when a tumor has grown beyond the mesothelium and can no longer be fully removed. It will also be done if a patient is too ill for more invasive surgery. One example of palliative surgery is thoracentesis. In this procedure, a doctor drains fluid from the chest wall to reduce pressure on the lungs and thus make it easier for a patient to breathe. In addition to these established treatments, there are also a number of experimental therapies, which are still being tested for safety and effectiveness. One example of an experimental therapy is multimodality therapy, which involves using various combinations of surgery, radiation therapy, and chemotherapy. The goal of this form of treatment is to achieve the benefits of and compensate for the weaknesses of each type of therapy. For example, this approach might involve using multiple chemotherapy drugs or combining surgery and chemotherapy. New chemotherapy drugs and combinations of drugs are also being tested in clinical trials. Until the safety and effectiveness of these drugs is officially determined and the drug is approved by the Food and Drug Administration, they will remain experimental. A patient can learn about current clinical trials by visiting the National Cancer Institute's website. As an individual's mesothelioma progresses to different stages over time, different types of treatment may be recommended. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.